As part of your bladder retraining program, your physical therapist has probably talked to you about what foods create urgency and what foods can calm things down. Pumpkin seed oil has actually had some really amazing recent research about helping with bladder symptoms. My name is Nari Clemons. I'm a certified pelvic rehab specialist, and we're going to talk about using pumpkin seed extract. In one study, there were 45 subjects, and they took 10 grams of pumpkin seed extract, which is called Cucurbita, which can be bought at most health food stores or medical grade pharmaceutical companies. And the pumpkin seed extract was taken 10 grams once a day for 12 weeks. And what they found in the study with 45 subjects is that they assessed them at 6 weeks and at 12 weeks. And they had them do an inventory called the Overactive Bladder Symptom Score. So what that is, it's an index they make with all these different questions about bladder, and people are rating themselves from like 1 to 5 or 1 to 10 on them, and then they take the score. And that score was significantly lower at 6 weeks and even more low at 12 weeks for people who were having symptoms of urinary urgency and urinary frequency. In another pilot study for BPH, benign prostatic hyperplasia, what we see with a lot of these patients is they're going to the bathroom a lot because the prostate is so enlarged, it's hard for them to empty. And so this was another 12-week study. It was just done at one site. So whereas most studies are done at multiple sites to validate them, this was a pilot study. So it was just done at one site. Once again, the subjects did a prostate symptom index, these men, and the average age was about 62 years. And then they took the score again, the test again at 12 weeks. There were 60 men in the study, and what they found is they had a 30% reduction in their symptoms. The amount of times they were getting up to pee during the night, which is called Nocturia, that was decreased. And when people are trying to empty, but not emptying fully, you can have them empty, and then you can catheterize them or use an ultrasound to see how much urine was still left in the bladder when they thought they were empty. And that's called a post-void residual. And they even found that the post-void residual decreased in these patients after 12 weeks on pumpkin seed extract. In a third study that combined various forms of pumpkin seed extract, the subjects again took it for 12 weeks. And the subjects were all women in this study. This study had 117 women, and they ranged in age from their early 20s to their late 70s. These were all women who had complaints of overactive bladder. So urgency, like they felt like they had to go a lot of the time. Frequency, they were going too many times during the day. And so again, they had the subjects take that for 12 weeks. And at the end of the 12 weeks, they found the people who were leaking in the study, these were all people who were leaking, they were using less pads. The amount of urine in their pad was less. The amount of urgency they were feeling in the day was less. And the other really neat thing about this study is they asked the patients, did you notice any adverse effects at all from taking it? And almost 96% of the patients said, no, we noticed nothing. And 99% of the physicians who were involved in this study said that they didn't notice an effect. So again, pumpkin seed extract, it can be taken. The nice thing about this is, whereas if you've watched my videos on baking soda, you can do both of those therapies at once if you want, but they hit different things. But the pumpkin seed extract, the nice thing is you can take it once a day. It doesn't matter if you're taking it with food or not with food. You can break it up into 2 doses a day. But it seems to be, for most of the studies, the dosing is about 10 grams a day to help people with urinary urgency. To learn more about urinary urgency and tips and tricks to help your bladder or just your pelvic health as a whole, go ahead and hit that subscribe button, and I'll see you later.